Hi, my name is Dr. Jacobs. I'm a doctor of physical therapy, advanced clinical nutritionist, and inventor of ASTR. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Alright, Judah, tell me what's going on with your elbow. What happened?
I, strangely enough, got tennis elbow from an actual tennis injury.
Okay.
It was an acute injury, and I've sort of had long-term nagging inflammation and general, like a dull, aching pain most of all the time.
Okay.
And then there will be moments where I'll lift something or even just gets touched, and it's a real sharp pain.
Okay.
Sort of caused general, not even just, it's pain more than anything. It's not even mobility.
So you have a constant pain?
Yeah.
How much constant pain from 0 to 10?
The constant pain's probably a 2 to 3.
Okay.
And then daily I probably have 10 to 20 instances where I reach 6 to 7.
Okay.
And then sometimes it can get up to 8.
And what aggravate your symptoms?
Good question. I mean, it's
Is it
sort
lifting,
of, yeah,
reaching,
it can be
typing,
all,
and
it
stuff
can be
like that?
literally just moving it.
Okay.
Sometimes I'll just be like, part of it's I'm left-handed, so I'll have my phone. And
So you're left-handed too, that's the hand you use it all the time.
Exactly.
Okay.
So it happens all the time. I'll be on my computer, and then it's just like I decide I need to do this way because the pain starts to build. So it's like sometimes I like just have to be like this in order to help it and try to get comfortable, but then my neck's stiff and weird, and so yeah.
So how long has this been going on?
Over a year.
Okay, so for the last year, what kind of treatment you had for your elbow?
I've gone to PT, a little bit of acupuncture, and then I got a cortisone shot, which did help for a little bit.
So you had PT, acupuncture, chiropractor?
I've done a little bit of chiropractic treatment lately, actually.
Okay, acupuncture, PT.
That's not really helping much, and he didn't claim it would with my elbow necessarily.
Okay, so let's do the motion that's aggravated now.
I mean, it's less about the motion. Like this hurts.
0 to 10, how much?
3 or 4.
Okay, and you feel it right in here, or it's going down and up?
It's kind of going down and up, but it's almost right. If I can feel it right in.
You feel it in the bone, or you feel it in the tendon?
It almost feels like it's in the bone. Here's where it is, right in there.
And is that where you had the cortisone shots?
Yeah.
The spot, exact
yeah.
spot?
Well, he kind of like poked around and tried to fill it up all in there.
Oh,
so, yeah, but it was.
Okay.
I guess it was right about there, and that's where the cortisone shot was. This is like this. It's like I'm not really feeling anything, but I push.
When you touch it, is it tender to touch?
It's tender to touch, and then if I put any real pressure on it, it's like real pressure. That here it doesn't hurt, but like here it's like.
How much from 0 to 10?
5 easy.
5 easy.
Yeah.
But lifting is okay. Just
it feels intermittent. It's almost like I just happened to lift it the exact wrong way or something. Like that hurts.
How much from 0 to 10?
Especially if it's out.
Okay. So we're gonna use that for testing. How much?
4 or 5.
4 or 5 for this. Okay. Okay.
Yeah, you know what? When I touch it, I would say it's more like a 6.
Okay.
Like this, I'm not even pushing very hard. If I happen to hit the right spot, it's like.
So make sure what I'm doing is not painful, okay?
Yeah.
You feel this knot here?
Not a ton, but I wouldn't be surprised.
This is the scar tissue.
Yeah.
Okay. Is it too much?
No.
Okay.
I can withstand a lot of massage.
So if you feel pressure, that's okay.
Yeah.
That's normal.
I'm like.
If you feel pain, that's not normal.
Yeah.
So make sure you let me know if you feel any pressure, any pain. Is it too much?
No, it's not too much. I can tolerate quite a bit of pressure, so, but it feels nice almost. It hurts, but nice.
Well, is it painful or just
it's
pressure?
painful.
Okay. Interesting. So you're injured while you're playing tennis, yeah?
Yeah, I think I'm one of the few tennis elbow people who got it from tennis.
Yeah. Well, you can get it from several sports.
Yeah, yeah. No, you can.
It's.
I feel like it's constantly re-aggravated because I have my phone and I'm
you
using my thumbs and.
Because you're left-handed.
Yeah.
That's what make it more. You're not giving it enough break to.
Right.
Yeah, especially if you have inflammation.
Yeah.
Well, I don't know if the. Well, the treatment you had, nobody had tool to work on releasing the scar tissue.
He would spend he has the tools, but he tends to use centrifugal force, and he can feel it all. He's like,
oh my gosh, that's a rough on the hand, like to use the to break the scar tissue.
It's interesting. He's very strong, but like I definitely, this feels nice, but it's like, all right, I guess that hurts.
Does it hurt or no?
Hurt, I guess, feels relative to me. It's like, you know, when somebody's like massaging you and it almost hurts, but it feels good. Like it's kind of.
I don't want you to feel the pain, okay?
Okay.
I want to just break the scar tissue without, because if you have inflammation there, and you massage it, you're gonna inflame it more.
I got it.
You know what I mean?
Yeah.
Like, do you massage open wound?
No.
Because it's gonna inflame more.
Right.
So just imagine internally, if you have inflammation, we don't want to keep rubbing it.
I gotcha. Yeah. That hurts a little.
Sorry. Okay.
No.
So that's why I want to make sure to be sensitive to the inflammation if you have inflammation.
I gotcha.
Feel this bump here?
Oh, yeah, that hurts.
No, sorry. Okay.
No. That's fine.
Is it hurt or it's okay?
It's okay.
You definitely have some inflammation.
Sure. Okay, that hurts a little.
This is actually a really light touch. No, I'm doing.
Yeah. Yeah, it's weird. I can't really.
Well, that's a sign of inflammation. If very sensitive to touch, that's usually that's an inflamed area.
Okay.
You know, compared to area that's not very inflamed.
Yeah.
You know. So.
You can feel that, yeah.
Yeah, you're gonna feel it more the scar tissue with the other tool. But I just wanna try to really break the deep scar tissue, the A5 here. How's that?
It's fine.
Okay.
It's fine. It's fine. Yeah, you can feel that. I feel like I'm constantly like popping that. Like
you try to rub it. Yeah,
try.
Yeah, that's a very thick scar tissue.
Yeah.
Well, it's hard to break the scar tissue with hand.
Okay.
You know, it's really hard, and if you really continue doing that, before I invented those tools, my hand was killing me.
Yeah, my hand's killing me.
You know.
Yeah.
So and it's hard to go too deep with the hand, especially if you start to feel pain.
Yeah.
You really you don't want to hurt yourself.
Yeah. Yeah.
You know. And this is more targeted. Like think about it this way: is my finger gonna go deep or this one gonna go deep?
Yeah. No, that makes sense.
You know.
Yeah.
So mechanically impossible would really go deep to break the scar tissue.
Yeah.
And to be like having consistent pressure on it.
Right.
You know. You feel this bump here? Here you go. That's a scar tissue.
I feel it. It just doesn't hurt at all.
Okay. So if you don't have a scar tissue, that's a scar tissue. You feel that?
Yeah.
Like a kind of like there is a rock or like a sand or
pebbles.
washboard or something like that. You feel that?
Yeah.
And it's actually jumping here.
Yeah, it's
So when you don't have a scar tissue, it should feel like nice and smooth like this.
Yeah.
Can you tell the difference here?
Yeah.
And this area.
Yeah,
Sorry.
yeah.
Sorry. Okay. Is it painful? It's okay.
It's okay.
And you will see the map of the scar tissue where you have redness. Look at here.
Yeah.
Here it's like a washboard. Here.
Yeah, it feels like, it sounds like a washboard.
Yeah. So because our muscles should act like a rubber band when you contract and relax, stretch like this. When you have a scar tissue, it's like you have a knot in a rubber band.
Right.
So when the muscle contracts, it does not stretch much.
Right.
And you have a lot in here. So your biceps attach from here to here, your triceps here. So it limits the range of motion, and you have a lot of scar tissue here in your extensor.
Yeah.
Your wrist extensor, so that's what causes limitation in range of motion.
Yeah. It's almost like I want to see how much scar tissue you find on this side to get an idea of like.
Of the other side?
Yeah, I almost like want you to tell me whether it's got. I'm sure I have some on this side.
Well, you know, from my personal experience, whoever did not have ASTR treatment, you're gonna have a scar tissue.
Yeah.
But that doesn't mean, you know, if your body did not dissolve it, you will have like maybe if you don't have issue, probably you have minor scar tissue. It's not really very thick.
Right. That's what I figured.
You know what I mean? But as we get older, our body ability, because normally our body should actually get rid of the scar tissue by itself.
Yeah.
As we get older, actually this process decreases significantly, and actually the scar tissue takes longer to dissolve.
Yeah.
I want to show you the map of the scar tissue. Actually, look here.
Yeah.
Look at the map.
Yeah.
That's a good visualization of. You see, it's kind of like a spots and red spots.
Yeah.
Okay, I'm gonna get you some water. I'm not gonna use the Magna Hill for the inflammation, just to rule out is it inflammation or proliferation. Okay. So you have it. Your.
Yeah. It's definitely. It feels weak in a sense. Like it's like I'm scared of it. It'll tinge.
Weaknesses, that's okay.
Yeah.
We are focusing on the pain now.
Right.
You should feel weak because you probably have not been using it much because the pain.
Yeah. It feels like it could break almost all of a sudden. It's like not break.
You anticipate it. You're just guarding.
The pain.
That's guarding. Okay.
It's better. It's gone down probably in one number.
How much is now from 0 to 10 and where?
The general pain's probably a 2 still, and now it's like now I'm feeling more stuff going on here than.
We did not work on the shoulder.
I know. It's like it almost feels like this got released, and now I'm feeling it as it's gonna come up.
Okay. Well, that's a good sign because when we release one area, your brain starts to compare loose to tight.
Right. Exactly. That's
so if you have a lot of tightness in the shoulder.
Yeah.
Your brain gonna pick on that. So let's touch it because you said it was tender when you touch.
When I touch right in here where the bone is, it's still the same. It feels like it feels like touching a bruise.
Okay.
So it's still a. It may have gone down a number. More of a 5 than a 6.
Okay, so you probably have a little bit inflammation. So I'm gonna use the Magna Heal. You don't have seizure, don't you?
No.
Okay. So I use it as a diagnostic and treatment tool.
Okay.
So if you have a mild inflammation, it should be like few minutes with the Magna Heal to get the inflammation down.
Okay.
If it's moderate to severe inflammation, few minutes will not be enough. Usually, like I have a new version of that, like a belt, that for moderate to severe inflammation, patient wear it.
Okay.
Depending on how much inflammation they have, and actually, with athletes, like if you play tennis or something like that, as long as it's not restricting your range of motion, you can use it while playing.
Oh, okay, cool.
You know.
What does the magnet do?
So our cells voltage runs between 20 to 25 millivoltage.
Okay.
That's a normal cell's voltage. So the inflamed cells or injured area, they found the voltage runs between 5 to 10 millivoltage.
Okay.
So think about it this way. If your phone on 5% of your battery, you're barely making phone calls. Okay, not able to use apps. And cells use electromagnetic currents to communicate and heal and function. So the goal is, this is extremely strong magnet, and we measure it. It was like 2 inches to 3 inches, goes deep.
Yeah.
So the goal actually to increase the voltage, to increase in the cells. So hopefully like a kind of a charge in it. So your body will start to move from inflammation to proliferation faster.
I gotcha.
This works very well as long as you don't have vitamin and mineral deficiency. So what I have found, if someone does not have deficiency, using the Magna Heal for a few minutes to half an hour, that should be okay. Okay. To get the inflammation under control.
Yeah. And if I do.
But for chronic inflammation, that's usually a sign, because you're young. You know, you should not have inflammation for a year.
Yeah.
So if you have a chronic inflammation, that's a sign, especially elbow or muscle or any body part. That's a sign you're missing either vitamins, mineral, or there is hormonal imbalance.
Okay.
Because you need D, you need magnesium, you need C, you need B vitamins.
Yeah.
You need a lot of stuff for your body to transition from inflammation to proliferation to maturation.
Yeah.
The magnet not gonna replace your B or magnesium.
Yeah.
You know,
Right.
it will utilize whatever exists there.
Yeah.
So for the patient that have moderate to mild, moderate to severe inflammation, and just a few minutes using the magnet is not enough, I usually recommend to do nutrition evaluation after the treatment
Yeah.
to figure out what is missing.
Yeah.
Because I had some patient, it was D, other patient was B, another patient was magnesium.
Right.
So we need to figure out which one is missing for the body that you needed to heal.
Got it.
Yeah, the other day I had a patient, like it was zinc.
Yeah. Okay.
Get to
Yeah.
the point like his body, any cut, it does not heal.
Yeah.
And when we did the testing, and I was like, it's severe zinc deficiency. So I like to think about more like, what is deficiency in your case, not instead of like, okay,
Right.
take this to decrease the inflammation. I'm like,
Right.
this is just a kind of like hit and miss. You know what I mean?
Yeah. No, that makes sense. I guess the question is obviously like diet is the best way to get those vitamins and stuff.
It's if you have deficiency, diet is good, but it's not enough. For example, if you have severe B deficiency,
Yeah.
okay, to get whatever in the capsule or 2 capsules, you need to eat grass-fed red meat,
Yeah.
1 pound a day.
Yeah.
Okay, realistically, you're not gonna do that.
Yeah.
So usually when someone has deficiency, we meet that deficiency with supplement, but we have to do the diet to make sure you're not missing this nutrition in your diet.
Yeah.
Does that make sense?
Yeah. No, I get it.
Because like when you have deficiency, you need to like 100 milligram.
Yeah.
You're not gonna get that from regular food. You need
Right.
to get double the dosage of the food. So you don't want to do that because you're gonna
Yeah.
you're gonna have issue with the weight and other
Right.
stuff.
Yeah.
You know what I mean?
I get it. Yeah, I guess my concern is sometimes they're not cheap and I pee out most of it or something. So that's,
Say that again.
you know, vitamins aren't always inexpensive. So it's like I do it, I pee out most of it. You know, I don't know.
Well, the reality before I studied nutrition,
Yeah.
I had a lot of health issue after my cancer treatment.
Yeah.
Fatigue and tired and migraines and like a lot of other symptoms.
Yeah.
And I used to read online, oh, that sounds like I need that vitamins, I need that
Yeah.
minerals. I used to spend like hundreds or thousands of dollars
Yeah.
on vitamins and minerals. But after studying nutrition
Yeah.
and doing the proper laboratory testing, it was like very targeting to the exact need instead of like gambling.
Right. Right.
Because there's like wide possibility, like
Yeah.
20-25 minerals that you may have issue with.
Yeah.
And vitamins, you have like 12-11 vitamins you might have issue with.
Right.
So it's better to figure out which really that missing
Yeah. Yeah.
before taking the supplements. Because if you take something that you already have, that causes imbalance.
I gotcha.
Okay, how does that feel? The constant pain?
That like created a different kind of pain actually. Like the resting pain's okay. It's still a 1 or a 2. The resting one that was normally a 2 or so.
Okay.
I'm feeling way more tension up here now. This, it's touching it. This feels better. I'm not finding the spot right away.
Okay, that's a good sign.
Yeah.
That's a good sign.
Yeah. Yeah, no, this is actually feeling better.
So you definitely have inflammation. Okay,
Yeah.
I'm gonna do another test.
Okay.
So let's do this motion with the weight. And how does that feel? Just feedback. You're doing it more than before.
Yeah.
You know what I mean?
Yeah, no, I get it.
Before, as soon as you were holding
Yeah.
it, it was like kind of obvious.
No, I agree. It's definitely better. So,
Okay. Are you back to normal? I still feel a little bit.
I'm back to normal before the injury.
Yeah.
No, I still have
How much from 0 to 10?
A 1.
Okay.
2, yeah.
That's not bad.
No.
Okay, I'm gonna do another testing, and this is the Magna Heel that I was talking about.
Okay.
This is a lot stronger than the other one.
Yeah.
So I usually do it.
The Magna Heel is more for inflammation or more for
Inflammation.
Proliferation. Okay.
Proliferation, all those tools.
Right.
Working on different layers. So usually with mild inflammation, immediately with using it, just move it around and tell me how that feels.
Yeah, I mean, I
Do you
can't
feel
tell.
it with it or no?
No, I don't feel like what it's doing.
No, do you feel the 1 or 2 that you were talking about?
Oh, yeah. I would say so.
With the magnet, the only thing you will feel if you really have severe inflammation,
Yeah.
like very severe cases, warmness. Yeah. Other than that, you should not feel anything. What I want to know is a decrease in the pain. That's my my main. Man, you're tight here.
Yeah, I'm feeling weirdly, even more than usual today. I woke up with tightness.
You woke up, or you?
More
okay.
like more tightness, yeah.
Yeah, you did not sleep very well or something.
I guess, yeah.
Okay, let me know if it's too much. And you said you're trapped, yeah.
Yeah.
That's you filled up mouth, right?
Very tight.
Yeah. Okay, let me know if that's too much. Okay.
Okay.
What's that?
It's good right there.
Okay.
Yeah, I guess that's what it feels like. It's like this has never gone away because it feels like my whole body's pulling
You
out.
try to compensate.
Yeah.
You know, like compensate with overusing your shoulder for your elbow motion, or like do funny stuff to
Yeah.
not experiencing pain here. It's very common, especially if someone has the pain for a very long time.
Yeah.
They start to compensate for the joint either above or below.
What's that? Yeah, exactly.
Compensate with the other joint to decrease the pressure, to the pain here, by using your shoulder more.
Yeah.
That's possible.
No, it's feeling a lot better. You know, it's like I almost can't tell. Like it's like, well, what does it normally feel like?
Because you had it for a year, so you had that nagging pain.
Yeah,
constant.
it's like,
yeah.
Yeah, no, I mean, I have to say it's like, doesn't feel like it's really present.
Okay, that's beautiful. Awesome.
Yeah.
So what do you think about after treatment? You had fracture, acupuncture, you had cortisone shot too, actually.
Yeah, the cortisone shot I felt really good once it like calmed down for about a week or two.
But
really good, like before. But
yeah,
now it's just like I feel like I need to do that throughout my whole body, and then it'll like
yeah. Well, we're gonna work on other areas, but
yeah.
like for the elbow, because you know, you will start to noticing other tightness in the body.
Yeah,
that's actually a good sign. That's mean like your brain moving on to other areas that need work on.
Yeah, it's funny. I'm like having sort of like some pain on the downside of this now.
Okay, let's put it on the other side here.
Yeah.
Okay. What about now?
I mean, yeah.
Because when you have inflammation, it's not one spot.
You're right.
So usually what I recommend when you have the Magna Heel too, is to really rotate the disc where you have inflammation to make sure to get all this inflammation down.
Yeah.
And you know when you touch it, you feel tenderness. You know, those are the areas that you need to work on it.
Yeah.
All right. So, what do you think about ASTR treatment after working on it and putting the Magna Heel on it? You had a PT, chiropractor, acupuncture, cortisone shot for the last year. So
yeah, I feel pain relief without having been, experiencing too much pain, which is nice. It feels like it's now a work in progress, but it doesn't feel like I have to punish myself to get there.
To get through the treatment. Yeah.
So I'm optimistic. It feels better.
Awesome.
Thank you.
Thank you.
Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
Call us today to schedule your appointment.